When you think about nursing school and things that you learned in nursing school, one of the things was probably the SBAR, situation, background, assessment, and recommendation. So we use the SBAR a lot as nurses in nursing school, and we mainly think of it as something that we use to chart often. But the SBAR is way more useful than that. And it's actually an excellent communication tool. So it helps you give clear handoff. It's good to communicate with charge nurse. It's got a lot of benefits when communicating with the rest of the healthcare team, physicians, pharmacy, RT, etc. So let's think about a case. So you're going to call the doctor and say, my patient has asthma and she came in yesterday and she was doing fine. She's been getting Ventolin, and mom says she's had asthma since she was little, and she was doing okay, but now her oxygen is below 95. So there's probably information that's useful in there, but the person has to figure out why I'm calling, because it's really not clear. So now if we organize it into the SBAR format, it sounds a little bit better. So what is the situation? I'm calling about a child who was admitted with asthma. The work of breathing has increased over the last 30 minutes. So now it's clear. Why am I calling? Work of breathing is increasing. So now get background. Patient was admitted yesterday, has been getting bronchodilators, or you can say Ventolin if that's what you've been giving. And until recently, she was improving. What's the assessment? So the assessment is, recently I've noticed an increase in respiratory effort, decreased air entry, and her oxygen's falling from 95 to in the low 90s, 91, 92. So now I'm actually sharing my actual assessment findings. So now it's getting much more useful. And now lastly, recommendation. This is often the hardest for nurses because they're like, am I recommending a treatment? What am I recommending? No, I'd like you to come and assess her. That's a recommendation. I would like you to come and assess her. I think this patient needs to be assessed. Do you want us to give another nebulized treatment or more puffers while we're waiting for you? Because maybe they were only ordered Q1 and you gave them half an hour ago, so you need an order for that, right? So those are the sorts of things that you want to sort of think about. So recommendation. So recommendation isn't just, I need you to do this, or I want this, or this is what the patient needs next. The recommendation can be a lot of things. So when you think, I think this patient needs to be reassessed, that's probably the most common. I think you need to come and see this patient. I'd like you to come and see this patient. But also, can we review pain management if the patient's still having pain and you've maxed out on everything? How about, I'm concerned that the current treatment isn't effective for this patient. Okay. What about, can you clarify what parameters you want us to use for this patient in this situation? So sometimes you get an order, but the order is somewhat unclear, or it's not clear what they want the next step to be. So of course the SBAR works during handoff, right? So it really prevents those long stories. You're gonna say, this is what we're doing, this is what the patient needs next. So the recommendation there would be anything outstanding or what's coming up imminently for the next patient shift. If a patient's really changing quickly, gives you a really nice framework for what you wanna be doing. What is happening? What matters in the background? Where is this patient's health history in this bit? What am I seeing right at this moment? What needs to happen next, right? So these are, a way of setting up your thoughts, right? So SBAR isn't something just to memorize as a test object, right, for nursing school. SBAR is really like a way to communicate. It's a thinking tool. It helps you build clinical judgment. It helps you think about your patient. So if you haven't been using SBARs, probably want to start. So situation, background, assessment, and recommendation. Clear communication, great tool to use during nursing school, but also afterwards. It's about making important information easier to hear so that everybody is listening.